This is Dr. Prem Kumar, a senior consultant diabetologist and cardiac physician practicing in Chennai for the last 23 years. I have done my undergraduate in Stanley Medical College in 1990 to 96 and my postgraduate MD General Medicine in Hill Park Medical College from 96 to 99. So viewers, today I'm going to talk a few facts about hypertension. What are the symptoms, complications of hypertension, and how important it is to treat the hypertension so as to prevent the complications of hypertension. So if you have been, or if one of your friends or even your loved ones have been diagnosed with hypertension, that is high blood pressure, we all know that normal blood pressure will be average around 120 by 80 mm of Hg. If anything more than that, we call it as hypertension or high BP. So if one of your friends or yourself or your loved ones have been diagnosed with hypertension recently, or if you are already a known hypertensive patient who is on medication, so this small presentation will be very helpful or will be useful for you because it can save you from potential complications of high blood pressure, like sudden deaths, heart attacks, or even sudden blindness, and also the brain complications like strokes, etc. So we all know that hypertension uh, is nothing but increase in the blood pressure of more than 120 systolic blood pressure and diastolic of more than 100 millimeter of mercury. So it's all established evidence that any increase in the blood pressure, it increases the risk of heart attack and stroke. So high blood pressure is responsible for nearly around 55 to 60% of all stroke deaths. That is the patients dying from any cerebrovascular accidents, that is the like paralysis and all, and nearly 25% of all coronary artery disease deaths in India. Coronary artery disease is nothing but related to heart, like angina, massive cardiac arrest and all. So you know that how important it is for control of high blood pressure. So you can see that nearly 60% of all sudden deaths occurs due to stroke, and nearly 25% of all cardiac deaths is due to the common high blood pressure. And one more important fact about high blood pressure is if there is an increase of 10 mm of systolic blood pressure, that's the higher value of this is increase of 10 mm of mercury, it increases the hemorrhagic stroke by 75% and also the ischemic stroke by 45%. So we can see that even a marginal or minimal increase of systolic BP by 10 mm, it land up in a great trouble by increasing the incidence of strokes. And also 20 mm of increase in the systolic blood pressure, it increases your renal damage by more than 80%. So it not only affects your heart, kidneys, and strokes, eye, etc. The entire body gets complicated due to high blood pressure. So we should always try to maintain BP as near to 120 mm of mercury. And one more thing is the high prevalence of hypertension in Indian population. Nearly 30% of the Indian adults are hypertensive. Out of this, most of the people are underdiagnosed and are all not treated. And nearly 30 to 40% they are still undertreated for hypertension. So there's a high prevalence of hypertensive adult population in India. So what are the common symptoms of high blood pressure? So mainly patients, you all know that hypertension is one of the silent killers, and the common symptoms will be headache, tiredness, breathlessness, there may be increased sweating, blurring of vision, sometimes bleeding from the nose. These are the common symptoms of high blood pressure. So coming to the risk factors, who are all affected? What are the risk factors of hypertension? So you can classify as non-modified causes and modifiable causes. So non-modifiable causes are your age. So the age, the more the increasing the age, increases the chance of getting hypertension, and ethnicity, and is a family history of already known hypertension. And modifiable causes are the stress, smoking, high salt intake, alcohol consumption, obese individuals, there's overweight whose BMI is more than 25, and sedentary lifestyles. So these are all modified causes of which can cause increase in the risk of hypertension. So we all know that hypertension is very easy to diagnose just with the measurement of blood pressure, which can be done by even a lay person, can be just done in one sitting in your clinic, and no need of going for any special investigating test or just BP measurement. It's very easy to diagnose, and it's also very easy to treat if diagnosed early, even before getting complications. And hypertension, we know that is one of the major causes for both mortality and morbidity, and it needs to be treated. Don't just ignore high BP and say that okay, I'm very young, we'll see in later half of the life. But even before reaching that later of the life, you will land up with all sorts of cardiac and renal complications. So it's extremely common population in Indian adult population. However, it's still underdiagnosed and undertreated. So this is the most common because most of the people, they have hypertension but they don't have any symptoms, so they're not diagnosed. And also if they are diagnosed also, since there's no symptoms, they don't take it very seriously and they're not getting regular treatment, and they'll end up with complications like cardiac and cerebral stroke accidents. So what is the main aim of our management is to save the target organ or the end organ from getting damaged due to this high blood pressure. So lifestyle modification along with the pharmacological treatment is one of the best way forward for treatment of hypertension. So what are the lifestyle management is? One thing is we have to have a good physical activity, and we have to reduce our stress, and we have to go for a low salt diet. If you're a smoker, we have to quit smoking. So these are the common lifestyle modification which helps in bringing down your blood pressure. And pharmacological treatment, and that the doctor will advise you according to the blood pressure and what are the morbidity caused by hypertension. So we all know that hypertension is it's a common symptom present in Indian adult population. More than 30% of the Indian population suffer from hypertension, and most of them are underdiagnosed and undertreated. So it's very easy to diagnose and easy to treat. So just if you have strong family history of hypertension, and if you're obese, and if you have a lot of stress, just check your BP once in 3 months. And once it crosses above 140, 150 mm of systolic BP, just consult your doctor and he'll advise you the best treatment, and you can prevent the complications, and you can have a very stressful life thereafter. Thank you.